Thank you, Deputy Speaker, and I rise to speak on the Public Health and Wellbeing Amendment Bill 2022, and it is a pleasure to rise and speak on a health and wellbeing bill that doesn't have some of the controversies that we were forced to discuss last year under circumstances that were challenging for everyone, but especially when we weren't given the respect of time and that was able to be given to us and have decent debate, but things were rushed through and debated on the same day as we were given notice of them. So it is good to have this time to be able to consult and look at the effects of these changes. This bill actually is an omnibus bill that seeks to address multiple issues, including some within the labour hire industry, removing the stigma around HIV and Hep C, providing personal immunity to the statutory office holders in line with statutory protection coverage in other states and territories, and expands the CHO's powers for pathology laboratories to provide additional data to the Department of Health and assist with monitoring public health and assisting in notifiable disease management. So that's actually where I'll start, because this is a bill that obviously I find fairly interesting, because we have been managing notifiable diseases quite well for many, many years, and I often talk about my health experience here, and I can remember learning in the late 80s about how we managed tuberculosis. It was a notifiable disease and still is, and there are many notifiable diseases, and there's a lot that goes on in the background so we can manage our public health. And when you see things like this bill, which expands the pathology's ability to cooperate and work together, which I, like the member for Lowen, who was already mentioned, have great confidence that this is happening very well already. But I see the opportunity that this presents to have it in the bill and endorse that, and don't have any issues with it. But it does lead to the challenges we do have, and there are diseases that need to be managed. And at the moment, or probably for the last few years actually, people might be surprised to hear that syphilis is on the rise, and it's important to know who's got it, how to manage it, but it's also important to make sure we're looking at population. So having this change which allows the data to be more looked at and see how many people in certain areas, and really manage population health much better, of course I'm going to endorse. So something like contact tracing, and I've said it in this Parliament already many times, it's not new. It's not new. It's something that the government has had a part to play in with the Health Department for decades. So it was quite disturbing this year and last year and the year before when, yes, I understand we were under enormous pressure, but it was really disturbing that contact tracing was so badly managed, and that we had so many instances where people were not given the information that should have been available if it had been managed properly. And we now know that the Health Department in Victoria is the least funded department in any state of Australia. So, and that's been going on way before the pandemic. And when you've got a Premier who was a Health Minister for 3 years before he became the Premier, that's just really disturbing, and particularly during a pandemic, that he knew that so well and didn't do what needed to be done to boost that capability. Yet other states were able to manage contact tracing. I'm actually pleased that they have said that contact tracing is no longer necessary. Over the last few days we've had that announcement. But I mean, they're just hanging on. The Labor government seems to be hanging on to this control, because people weren't using it, but they've left the industries like the hospitality industry still having to contact trace. And I had the COVID-19 infection in early January. I didn't get a contact from anyone in contact tracing. They didn't contact anyone I had been in contact with. It hasn't been working for a very long time. So the thing is, people are sick of the control, and they want to have the respect of their lives back, and they know we need to do things differently, and COVID is real, and we need to make sure we've got the right things in place. But when we don't need things like the contact tracing that has been changed now, the government needs to be responsive. And they say there's going to be science decisions around it, and we're going to find out more in the next couple of weeks around the mask change, for example, that we heard about yesterday, which I don't know too many people that make much sense of this. Why on earth would you want to have masks on the people behind a bar but not masks on the customers? Why would you have masks on kids from grades 3 to 6 but not year 7 or year 2? You know, when a doctor comes in and does a ward round, they give you a treatment plan. They have options. They might use an allied health framework to manage a patient. They might use a pharmacological model, such as a medical model, or they might use a surgical approach. But every time you listen to the rationale for their treatment plan, there's a science behind it, and you can figure it out. Now, we've gone through a pandemic where the medical professionals have just been left trying to work it out, trying to commentate, because we've known for a long time that some of the things just don't make sense. It never made sense to shut down playgrounds. It never made sense. And there was no evidence of a curfew having any evidence behind it. So whilst it's so important to do things to bring your community with you, and that's why I don't have any problem with, for example, this change in this legislation that helps manage notifiable disease far more effectively, and we should always improve that, the community need to know that the government is doing it in a way that has a science behind it. I'll be interested in 2 weeks' time to see how the government explain some of the changes that they're putting in place, which now they have to do within a 2-week framework. I'm not convinced we will get proper explanations that medical professionals at the very least will be able to understand. I think we'll get a lot of government speak that says nothing, but there's a lot of words there. You know, what I think we've seen from this Labor government managing the pandemic is a really iron fist approach. And if you say, well, you know, it kept us safe, have a look at the states around Australia and ask yourself, well, if we had such a heavy-handed approach, if it worked, how come we had how come we've got the highest death rate? How come we had the longest lockdowns? How come our kids missed out on the most education and some will never catch up? How come our whole regions were locked down when there wasn't any disease for miles, and supposedly contact tracing would have helped anyway? I just think the secrecy, the lack of health evidence that should have accompanied these changes is appalling. And I think somebody said, this is a government who knows what's best for you. It knows that you can't be trusted with the truth, so it doesn't tell you the truth. And I think that's a very powerful quote. But humans are pretty impressive, and I'm very amazed and impressed by the community of South West Coast, the community of Victoria. They've gone and got vaccinated. You know, we've got 93.94% vaccinations. We know the importance of boosters. I'm very grateful to have been vaccinated. I'm very grateful that I was, not too unwell. And we don't need to have mandates in place anymore. People have made their decisions. It was about health capability, and our hospitals have that capability. And to lock people out of the workforce, some people have had terrible health experiences in their life, and they will not necessarily feel comfortable. And, as a nurse, we've always respected that. I've never said, you're sorry, obesity is something that is wrong, you've made a poor decision, so your overweight situation means that you're not welcome in the health service, you're not welcome to have treatments. It's the same with smoking. These are age-old discussions that we've had in health for years and years. So now that we've got the vaccine rates up, we've got people on board, we need a confidence campaign to get people out and about, we need to live with the virus. The mandates have no place anymore. They absolutely have no place. We're here in Victoria in the worst state because we've failed, the government have failed the Victorian people drastically. Our children are struggling. We're talking mental health issues in children. We wouldn't have said those words even 30 years ago. But, it's actually a tsunami now. These kids have been put under enormous pressure. I remember a 5-year-old in my life 2 years ago, ran out of the shop we were in together because he was coughing. He was terrified he was going to get into trouble. He actually said to me one night, I was babysitting, he thought we weren't allowed to go to Grandma's place because he'd heard that, and he said, "Where do I hide when the police come, Nana?" These are the sorts of things our kids have been subjected to. So let's get on with a confidence campaign, live with the virus, encourage the vaccine, the booster, get rid of mandates, stop being a divisive government. Labor have done enough damage. It's about moving forward, and I can't say more clearly, we need a confidence campaign and get back to real medical interpretation and give people the right to knowledge and honesty.